There is a cure for COVID.
Hey YouTube, it's your girl Dr. Ciri here, coming at you with another video. In today's video, I am going to be answering some questions that I have been getting about COVID-19. Before I get into the video, do me a favor and click that subscribe button. Also click the notification bell so that you never miss an upload from me. Give this video a thumbs up if you like it, give it a thumbs down if you don't, and that way I'll know what type of content you all want to see from me.
Now, before I start answering these questions, I just want to say that I am an internal medicine physician who practices hospital medicine. So I am a hospitalist physician. That means that I take care of patients who are sick enough to be admitted to the hospital. And a lot of times when people have COVID or have terrible symptoms from COVID, they wind up admitted to the hospital. So I've taken care of lots of COVID patients, and I have been able to see firsthand how this has evolved and how our treatment and management of it has evolved. And so I will be speaking to you all from that perspective.
Let's get into these questions. The first question, is COVID real? Yes. COVID is very real. COVID is very real, and it can cause very real symptoms. There can also be asymptomatic carriers of COVID, meaning patients who have COVID but don't have symptoms from COVID. So yes, it's real. Yes, it causes symptoms. The second question, is it like the flu? Yes, yes, and no. So COVID, like the flu, it attacks your upper and lower respiratory tract, so it can cause a pneumonia. But one of the things that we're seeing with COVID, especially in the hospital setting, is that it can cause a lot of other stuff. Now, the flu, in comparison to COVID, seems very straightforward. It's a virus, it attacks your upper and lower respiratory tract, it can cause cold-like symptoms, it can cause pneumonia-like symptoms, pneumonia meaning a lung infection that can also cause you to be short of breath and have low oxygen levels, that sort of thing. It can do that, but COVID, it does a lot of other things. We've seen patients present to the hospital with strokes because of COVID. We've seen patients present with pulmonary embolism. COVID is a beast, okay? It causes this pneumonia, this viral pneumonia, and it actually attacks both of your lungs. That's commonly what we see on our CT scans with COVID, that it is attacking both of your lungs. People have what we call bilateral infiltrates or bilateral patchy opacities in their lungs. It can cause you to progress to what we call ARDS, which is Acute Respiratory Distress Syndrome. And that's basically where your lungs are just shot. Okay, it's very hard to oxygenate, it's very hard to breathe, and you end up on a ventilator in the intensive care unit. Yes, it's like the flu, but it's also not like the flu. And the issue at this point is, with the flu caused the 1918 pandemic, right? And here we are 100 years later, we have a flu vaccine, so the flu isn't wreaking havoc like it did back in 1918, but now we have COVID. And we don't have a vaccine for it. We don't have a cure for it.
There is a cure for COVID. All this foolishness does not need to happen. There is a cure for COVID.
Stella. Can I call you Stella? Dr. Immanuel. What's your location? I just want to talk. About this.
We don't have a cure for it. Another thing that makes it different, with the flu, we have Tamiflu as an antiviral that we can use, and we also have the flu vaccine, which offers us, or which affords us, some sort of herd immunity to protect us against the flu. But with COVID, we don't have that option. We don't have that luxury. Now, we do have remdesivir, which is an antiviral medication that we use in COVID patients. What we're seeing in the hospital with remdesivir is that it does help. The use of these drugs, the way we're managing COVID is evolving because we are learning as we go. The third question that I got is, are doctors experimenting on patients?
And I actually got a comment about this in one of my videos that I deleted because I also didn't want misinformation about medical things floating around on my page, since I am a physician, even though this page is not for medical advice, it's not for that sort of thing. So, but I just didn't want that misinformation floating around out there.
So one of the things this person said was that physicians are committing suicide because of how COVID patients are being treated. No. Physicians are committing suicide because of how they themselves are being treated, okay? Physicians are committing suicide because of things that are happening to them. Physicians themselves are the ones who are treating and managing these COVID patients. And yes, it is depressing, it is sad to see people dying from this, to see people succumbing to this illness. But physicians are not killing themselves because COVID patients are being mistreated. We're the ones doing the treatment, and we're doing our very best to ensure that these patients are getting the best care that they need. Now, I will say that it may feel to people as if they're being experimented on, so to speak, because there's just a lot that we do not know about this disease. There's a lot that we didn't know about this disease, and that's why it's called the novel coronavirus, right? It's new. It's not managed like a typical pneumonia. It's not managed like typical anything. We were learning as we went. It may feel as if doctors were quote unquote experimenting, but doctors are not in the business of just randomly experimenting on patients. We take the knowledge that we have and we do the very best that we can. Are doctors experimenting on patients? That's a hard no. The other question I get is, if I think I have COVID, what do I do? So that depends, right? If you feel like your symptoms are symptoms that you can manage at home, by all means, manage them at home. If you feel like your symptoms are not symptoms that you can manage at home, then you need to go to either an urgent care or an ER. Now, if you want to know whether or not you have COVID, you can go to a drive-through testing center. If you feel well enough to do so, you can go to an urgent care center and get tested, or you can even go to the ER. Now, if you go to the ER and they check your vital signs and they find that you're technically medically stable, but you have COVID symptoms, they will refer you to a drive-through or a testing center. But if you go to the ER and they check your vital signs and labs and all that, and things are abnormal and you need to be admitted to the hospital, then you'll get COVID tested there and you'll be admitted to the hospital for further management and treatment. That's what I would suggest. If you think you're having COVID symptoms, get checked out, but don't be alarmed if you are suspected of having COVID and you're sent home, or you're sent to a drive-through center and then home. The last question I get is, how is COVID affecting children? I wish we knew. I wish we knew more about how COVID is affecting children. Now, I'm not a pediatrician, and this information is coming from the perspective of someone who has just watched the news and maybe read an article or two. There are a handful of cases of children being affected, but it's not an overwhelming number from what I'm gathering. Now, we don't know. We don't know what the future holds. We don't know how this strain is going to mutate and change. We just don't know. And like I said, we're learning as we go, and hopefully more information comes out about children and COVID and how we can deal with it. I'm sure once there is more information, our pediatrician friends will let us know what's up. So hopefully today's video was helpful for you. Hopefully that answered all of your questions. If you have any more questions about COVID that I can answer, feel free to drop them down below. Don't forget to like, subscribe, comment, and share, and I will see you all in my next video. Bye.